Behind every master was once a curious student. Every clinical pearl has been earned through years of trial, error, and evolution. Behind every success are stories, challenges, and a unique journey. I'm Dr. David Norcross, and this is Clinical Curiosities, conversations with specialists, innovators, and experts who help move our industry forward. Okay, so joining me today on the podcast are two of the most recognised specialist prosthodontists in Australia and directors of the prestigious Brandmark Center here in Perth, Western Australia. I've been fortunate enough to know these guys for quite some time. It's Dr. Graeme Carmichael and Dr. Glen Liddleow. After doing a Google search of their various positions, qualifications, etc., and achievements, I realised that if I listed them all, this could end up being a 3-hour podcast. So I've tried to summarise just some of them. Dr. Graeme Carmichael graduated with honours from the University of Western Australia, earned his doctorate in prosthodontics from the University of Sydney. He has become a leading voice in both the surgical and prosthetic sides of implant dentistry and is a key opinion leader for Nobel Biocare. He is a consultant prosthodontist at the Perth Children's Hospital, a senior clinical lecturer at the University of Western Australia, teaching both undergraduate and postgraduate prosthodontic specialty program. He's a fellow of the Royal Australasian College of Dental Surgeons and the International College of Dentistry and Pierre Fauchard. Fauchard, is that how I say it? And Graeme delivers various lecture programs both nationally and internationally on a variety of topics from restorative rehabilitation to surgical and restorative implant dentistry. He's also published various articles in peer-reviewed journals on immediate placement and loading, digital workflow, and the influence of prosthetic designs. And I also have clinical associate professor Dr. Glen Liddleow. He is also a graduate of the UWA University and completed his pros training at Sydney. He's a global key expert and consultant for Nobel Biocare and has been on their development team for a number of years, doing a lot of work out of Zurich. He's a consultant prosthodontist at Perth Children's Hospital, associate professor at University of Western Australia, a fellow of the Royal Australasian College of Dental Surgeons and Pierre Fauchard Academy, and in 2020 he was awarded a fellowship from the Academy of Dentistry International for his contributions to the advancements of the dental profession. He is an international keynote speaker, often seen on the main stage at global conferences, and is an educator for numerous universities and industry boards delivering dental education. On top of all this, he has also presented over 1,000 papers, including research on immediate loading, surface technology, and the treatment of advanced bone resorption and implant aesthetics. I met these guys when I first moved to Perth around 15 years ago. The first person I asked when I said, who should I hook up with if I want to learn more about implants and get some help, and the Brandmark Center was the first name to come up, and that's where I want to delve into a little bit of the history of that prestigious center. I want to talk about their journey into prosthodontics, the legacy of the Brandmark Center. We want to touch on the Nobel Symposium, which is something we're all involved with. Maybe find out a little bit of what the day in a life of a prosthodontist looks like, how that's changed over the years. Something I need a bit of help with is balancing the act of work and life, especially with a family, and what does the future of implant dentistry look like. So welcome, gents. Let's start with your specialist journey. How did you both find your way into prosthodontics? And was there any specific light bulb moments or mentor who steered you towards that specialty?
Well, I think it's a really interesting question. I think for me, I was going into MaxFax, and I'd already sort of organised all of that sort of stuff. And then I got a phone call from a prominent prosthodontist around Perth, Brad Shepherd, and he called me up and said, "You want to come and work for us?" And at that stage, he had a pretty strong connection with Patrick Henry, who was the first guy who started the Brånemark Center and also brought implants to Perth, or to Australia really. And so I kind of always had an interest in pros. I quite liked that sort of aspect. And then I thought that the implant sort of scene would be pretty good because that would combine a bit of surgery and also the prosthetic aspect, and I thought that was a pretty good fit. So I then started working for them and had quite a lot to do with Pat Henry and some of the original research and stuff that we did. And then after around about sort of 10 or so years, 15 years, I think, then I decided, because there was no real pros program in Perth at that stage, and so then I did one of the first actually programs in Sydney that allowed you to do your clinical work externally. So I sort of travelled to Sydney and did my program over there. So that's basically how that all fitted in.
And yourself, Graeme?
So going through UWA, going through uni, pros was always the subject of interest, and being able to treat the diverse range of patients and seeing the way that you can help and change people's lives. So dentistry there's so many facets to it, but pros was always the part of it that was most interesting to me. And during my time as an undergrad, you start hearing about the landscape out in Perth, and I heard about the Brånemark Center at that time, and thought that that would be the pinnacle of where I'd aspire to be, and so I then sort of sought out Glen and Matt Kinsella and Brad at that time, and spent some time there as an undergraduate, hanging out in the library and using some of the resources and building that connection. And then it was a couple of years after graduating that I got a phone call from Glen on a Tuesday afternoon inviting me to come and have a chat, which we did. And so, that was 20 years ago this year. And so that was the start of my time at the Brånemark Center. But as Glen said, the history that we have with what Pat had done and created, and the involvement with implants here in Perth. And so that then sort of steered my interest in my journey. So I was working there for a number of years before doing my specialty program through Sydney as well. And I think that was the best way of doing it. So you're going into a pros program as an experienced clinician with a good foundation of a broad range of things, because a lot of pros programs won't teach people how to do implant surgery, or it's a dedicated 3-year time, but there's still a lot more of it that needs to go into it. So that was where I sort of started, but pros was always the focus. That was always the goal.
It's probably a good lesson there for younger dentists. I always get asked, what should I do to progress? But just being present at the Brandmark Center, getting yourself known, mixing with those people early on, I think, creates those connections. And I would say to the younger dentists, be a bit of a pest, I certainly was. Probably pestered you two a fair bit in the early days.
Yeah, a little bit.
Just to sort of, but and when guys come and say, "Oh, can we come and watch? Can we?" I think it's great if an undergrad shows interest in their spare time to come and watch what we do. I think,
and the door's always open. We're always offering to people to come and watch and to see what we do, and it's actually surprising, because you put it out there to lots of people, but not all of them take it up. And the ones that do, they get a lot out of it.
Yeah, that's great.
I think the other thing is just knowing what you're going to get into as well. Like the life of a prosthodontist is not just cutting crowns all day, every day, or something like that, which some people might think, or might be just all, full mouth reconstructions or something. It's not that at all. So it's knowing what you're going to get into before you commit to doing 3 years and go, actually, I don't really like that much.
And what was the expectations of the training versus the reality? How did you find it? Because it's a pretty intense course. I'm guessing you're full time.
I think
probably a bit skint at times as a long-term student.
I think the thing is that people often, they might think, I can cut a really good crown prep, I can place a really good implant. But that doesn't mean that they can do like a full mouth rehabilitation or a full arch implant case or something. And I think prosthodontics is sort of the most holistic kind of specialty, in that we really look at the whole patient. And so when we're dealing with it, we're really delving into why that person has got to that situation. Do we need to involve gastroenterologists? Do we need to get involved, psychologists, psychiatrists, and many other sort of sleep physicians and, a whole slew of different sort of practitioners that we might need to involve. And we then become the orchestral conductor, if you like, of a lot of that type of thing, in that you're really looking at very deeply into sort of where that patient is, why they're there, where they're going in the future, and what treatment, if any, we provide that person. How's that going to go, and how's that going to go from the long-term perspective? We're certainly not looking at a tooth-by-tooth kind of arrangement and just going, I'm filling that hole or crowning that tooth. So I think that's where the diagnosis and treatment planning aspects of prosthodontics is probably the most critical part. I mean, you often say, well, anyone can ring bark a tooth or plug an implant in or something like that. It's really what goes on behind that as to the critical thinking that goes into prosthodontics compared to what you would have learned in, say, dental school, for instance.
Yeah, and it's a brutal program, really. I think any specialty program is, but the time, effort, energy, everything is on hold, and you're committed 24/7, 7 days a week. But I think what it does, it teaches you the mindset of how to diagnose, how to analyse, how to treat, and how to maintain. So as Glen said, it's that holistic view. And a lot of the time I think people also underestimate what we do in that information gathering and then sitting down and formulating a plan. When we consult someone for their initial consultation, we'll spend a lot of time just talking, finding out why have they turned up, why is their referring dentist sent them to us for treatment, work out then what the problems are, what then needs to be done. Then it's information collecting, and then it's formulating that proper plan so that then they can be treated appropriately, whether that be tooth-borne or implant related or however it is. And sometimes, the best treatment will be no treatment as well. But without that analysis, it's really hard to do the right treatment for them. And I think a lot of, discussing with general dentists and other people as well, a lot of people just don't spend that initial time. They see someone, they want to do something quickly, they don't do the analysis, and that's where things can go wrong. And that's then the challenge. So that's what we try to avoid and make sure that we've surrounded ourselves with good people that can help us where we need. Yeah. So I don't do endodontic treatment as a general dentist. I used to do a lot of it, but that's not what I do all day, every day. So I deal with my orthodontist, I deal with my endodontist, I deal with my periodontist, I deal with the team to then, to look after the patient.
And with the sort of training that you got, did you guys, because coming from dental school, didn't do specialty training, but I came out of dental school and felt like I didn't really know that much. And it was then, once I was out there, that's when I started to learn fully. You think you're prepared, but then your first day in practice, you're not. With the specialty training, do you come out and do you feel prepared for that environment, or is it similar in that you are then continuing to cut your cloth in private practice?
I think part of that would also depend on when the clinician has done their training. Yeah. So if someone, it's generally a minimum of 2 years before going into a specialty program, and certainly, being involved in teaching, undergrads and teaching postgrads, you see it. So someone who's got more experience, who's treated more people, who's been around in dentistry for a lot longer, they've got a bit of a broader understanding of how things work. Because if you look at the literature on a particular technique, they might not be able to transpose that into their hands for that outcome for that patient. So then I think what's important for someone going in is to know, well, the program's going to teach them the basic foundations, which they then need to build on. You're not going to graduate with the ultimate skill set to do everything. Yep. So if someone's going in with a really good foundation, then they can build on that. So then someone who's done a lot of implant surgery before doing a pros program, you'll learn, the nuances of it. Yeah. Someone who's done a lot of, and in my world with, the experienced mentors and, that I had before going into the program, then you're looking at tackling things differently, and that's where everyone's experience is going to be different. Yeah. Did you get a lot of implant exposure during the training program, or was that more
before and then when you came out?
I think, most programs will have quite a lot of implants in them, and it's definitely a large part of it, you know, especially in the last sort of, 10, 15 years or so. But it's at the end of the day, it's a lifelong journey. Like you say, you come out of dental school, you come out of pros school, and you still got a whole lot to learn.
Yep.
And, as things evolve at a very rapid rate, the stuff that we were even doing maybe 2 years ago or 3 years ago, we're doing differently now. So it's sort of, you have to sort of, look at that as a lifelong learning type of thing. And you're always learning. I'm continually learning whenever I go to any big conference or catch up with some of the meetings that we have. You're always learning something new. Someone's come up with some different thing.
Yep.
And it's usually an evolutionary type of thing rather than anything too revolutionary, but you always pick up at the minimum tips and tricks. So,
and what's the intake like for prosthodontic training nowadays? Is it high still? Is it is it not as popular? Where does it lie at the moment?
Well, Perth is a couple a year, two per year, and I think there's a fairly it's fairly difficult to get in. It's quite competitive, and there's certainly plenty of work for prosthodontists. I don't think any of us are sitting around twiddling our thumbs. And I think as dentistry becomes more complicated, there's a lot more techniques, a lot more things that people do. There's a lot more complications. People are keeping their teeth for a lot longer. You're going to see a lot more difficult things coming up. And also the expectation is much higher now too. So
any sort of advice for a young graduate dentist who's thinking about doing the prosthodontic program, what would your sort of main advice be to if they're considering that, if they wanted to succeed in prosthodontics?
I think one of the graduating uni is a daunting prospect anyway, and working out the practice that you go into and who you're surrounding yourself with and the mentors that you have. Personally, when I graduated, I didn't work on Tuesdays. I worked longer hours other days, and so I used those Tuesdays to go and spend time with other people.
Yeah.
So I spent time with endodontists and maxfacs and prosthodontists, so I was using that to build my knowledge and to build, my experience. And so then I think that would be the biggest thing for a new graduate, is to actively seek out to help develop your skill set and your learning in that early stage. The ADA runs programs, the new graduate programs, so they run those for that specific cohort to go and attend, to learn, improve their education. But if they're interested in doing a program, I think getting as much experience in that field is also, really useful, so that then you've got an understanding about what you're embarking upon. There are people who start a pros program and who don't finish it, who they realise, look, it's not actually what they thought it was going to be, or their interests, were elsewhere, or that they preferred to be a great general dentist, and that's okay. But it is something that I think you have to have a passion for what you need to do during the program, but also lifelong as well afterwards. Going in with a good idea that that's the right choice that you want to do.
Yeah, I would say most specialists would be quite happy to have you come and shadow them for a day or something like that. And I think that's a good way to pick things up. I think most pros programs particularly wouldn't take you on unless you had demonstrated a pretty strong interest in prosthodontics. So, and that would be like having a relationship with a prosthodontist that and they can vouch for you, that you at least show some interest, and then obviously doing as many courses as you possibly can, and any sort of continuing education really at all is going to be useful. Usually you have to sit the fellowship exams, like at least the part one of those, and that kind of sorts out the people who are really into it, or who are just sort of having a dabble, kicking tires, so to speak. So I think it does require a commitment, as what Graeme has said, and so I think that's what most people that are picking, clinicians that might want to do prosthodontics are going to be interested in, whether that person's got a solid interest.
Great. And moving on to your involvement with the Brandmark Center, like I said early on in the podcast, I'd obviously heard of Professor Brånemark, and then when moving to Perth, it was kind of like, this is where you need to go. These are the people you need to spend time with. How did you both end up there, and what let's talk a little bit about the history of the Brandmark Center in Perth, because I think when I moved here, it was Brånemark and particularly Nobel Biocare had a really strong foothold in the state. I think I remember coming to one of your study clubs early on and mentioned that I'd placed another system back in the UK, and I felt like I was going to get thrown out of the room because everyone at the time was using Nobel Biocare, and I also remember having done some implant training in the UK. I moved here in 2011. Coming to some of your guys' meetings, going to the symposium, the first symposium, which we'll talk about soon as well, and just thinking, okay, this is another level. This is a higher standard that I'm looking at. And I don't know what it's like in the UK now because I don't live there anymore, but I just remember thinking that at the time that the standard of implant treatment here was on another level at the time.
Well, I can probably talk about the history aspect. So Brånemark, as we all know, invented osseointegration, and then basically treated patients in Sweden, and then had 15-year results before he actually released it really to the general public, because not general public, the general dental world, and that was because things like subperiosteal implants and blade implants and the other sort of implants had such a terrible success rate. They had a very high failure rate, and so they had a bad reputation. And so he wanted to make sure that this new aspect of osseointegration was going to work. And so from our involvement was that George Zarb, who you may remember, a giant of a prosthodontist, wrote most of the textbooks, and he was a good friend of Patrick Henry. He said to Pat, hey, you should get involved in this. This is pretty good. And so then Pat went to Sweden, met with Brånemark. They liked each other. Then they brought it to Australia and then started replicating some of those trials, which were initially all full mouth type of rehabilitations. And so that was a very hospital-based, surgeon, prosthodontist, all that sort of thing. It was very strict. And so then very soon after that, they developed the concept of a Brånemark Center, which is now there's something like 20 Brånemark Centers around the world, and that was to be involved in collaborative research and education and treatment of patients and that type of thing. And so that's Pat started the first Brånemark Center in Australia, well, the only Brånemark Center in Australia, which is in Perth. And so the idea of that is that you, do as high quality clinical practice as possible, and then you also do research and education and all that type of thing, anything to do with implants. We don't just limit ourselves to implants, but it's that is that type of thing. And then the first company that made implants for Brånemark was Nobel Pharma at that time, which is a Swedish company, which has now turned into Nobel Biocare. And so then obviously implants were synonymous with Nobel Biocare. And so, and as Pat and myself and then Graeme did most of the education of implants at that time, then Perth was a pretty Nobel Biocare kind of town. So, and Nobel Biocare has always had the lion's share of all the research that's been done on implants, and have done by far most of the innovation of various things over the years. So, and most of those are very clinically based to sort of help the clinician as much as possible.
And is Pat still involved with the clinic?
We still talk to each other quite a bit, and we've published actually a long-term retrospective on treatment of children with oligodontia only last year. So we still do a little bit of research and stuff together, but he is well and truly retired.
Yes. And yourself, Graeme, you came on board. I think we spoke before. Glen was actually one of your clinical tutors at Sydney. Is that right? And then you obviously came on board once you finished.
Before then. So so I joined in 2006 and then started my pros program in 2011. So it had been a little bit before my time at Brånemark and before doing my program. But so over that time, it was exciting. Pat was still working, and he was reducing his clinical practice at that time. But spent a lot of time with him, and that was an interesting experience as well when you've got someone of his caliber and you're there meekly going, to discuss a case, and his response initially would be, well, you don't have enough information, go back. And so you learn and develop, what's necessary in that regard. But he's always been a wealth of information and a fantastic mentor and a great person. So we're privileged that he's still with us and still dedicated in the way that he has been, and he's still passionate about what we do and things that we're involved in, and is always still reaching out and having a chat and wanting to know what's happening and offering advice for things as well. And he's always interested about the patients. When there's patients that I see who, so I look after some of the patients in Pat's early trials in 1981, and I see them and they're always asking how Pat's going, and I'll relay that to Pat, and he's always got a story to tell about them, even though the treatment was that long ago. So that's we're certainly fortunate with the legacy that Pat has created for us here in Perth. And as Glen said, the history is long here in Perth, and we've got the recognition of that nationally, I think, as well. Most people, or a lot of people in dental implant world have heard of what happens in Perth, but we also sort of go under the radar quite a bit as well.
Yeah, I think it was interesting when we were in Las Vegas last year for the symposium, and they had some of the old pioneers on stage, and it was interesting to think that what they did back then. I think we've probably moved a little bit away from evidence-based dentistry. I think in the modern social media world, it's more sort of can be more Instagram based than actual evidence, and it was it's. I think now I'm teaching, I probably read more studies than I used to, because I want to make sure that what I'm teaching is evidence-based. And I think we probably need to focus a little bit more back on that rather than just what the cool kids are doing.
Absolutely.
Yeah. I think there's a sort of unfortunately, things like treatment planning and diagnosis don't get the clicks.
Yes.
Compared to, I don't know, suborbital fixture placement or something like that, So it is a bit of an issue in that everything is down to sort of like 1 minute, 2 minute kind of things these days. And
touching on the symposium, my first experience of a Nobel Biocare symposium was Sydney. I think it was 2011.
Mm-hmm.
We were there, and again, it was off the back of moving to Perth. Where do I go to learn? And the Nobel reps had told me about what was going on. And again, I went to this event in Sydney, which was something I'd never really experienced on that scale. And just being in the same room as some of those speakers and looking up on stage on what was achievable and where can I set the bar in where I want to go with my implant career was on show in Sydney. I think, did you speak yourself at that one?
Yeah, actually I was one of the scientific directors there, so I'm glad you said nice things about it. I think that those Nobel Symposiums were a fantastic showcase of where implant dentistry was able to go. It was, I kind of liken those as like the Formula One of like implant dentistry, in that you really see the sort of like the highest possible result out of. So a lot of those clinicians that are showing, the lecturers that are there, are the best in the world that come in, and from all over the world. Like you'll get people from Brazil or Italy or Portugal or, all sorts of manner of places. Some might have been from Mexico, areas where you wouldn't even sort of think so. And then, but because they're doing really fantastic things, they've been sort of, handpicked to really give the best possible outcome. And so back in those times, like really we'd gone from the wonder of osseointegration to, knowing that works pretty well. But then this was this huge refinement as far as aesthetics go.
Yeah.
And I think that was where, a lot of really interesting techniques, a lot of interesting sort of components and stuff came to the fore, and you're able to see what was going on there. So that part was like really about showcasing a lot of the latest and greatest, but always on the back of sort of like research as well. So you would have noticed there's quite a lot of people that were, show the evidence, like what we're talking about, as to, well, is that going to work for a long time? Does that look, because you can, like now with the Instagram sort of world, also back then it was like you had some speakers that would say, oh, this is how you do it. And then next year it's like completely different. It's like, oh, no, we don't do it like that. So one thing that, like we've always really tried to make sure of is that you had speakers that were able to sort of walk the walk for a fair amount of time, not just, so that they could say, all right, well, this is what happens in 5 years, in 10 years, in hopefully longer than that. So
I mean, it was off the back of that symposium that I think I took a long hard look at myself and said, right, I need to know more about this. These 1 week, 2 week courses are not gonna give me enough information, and off the back of that I went and did the guide program which you were involved with, because I think I'd seen yourself at the symposium, maybe Sasha had done something, and that list of speakers that were there were then teaching on this program, and that kind of kicked off my implant career. But we sort of lost the Nobel Symposium for a little while. It seemed to disappear, and has actually now made a resurrection.
Well, unfortunately, sometimes in upper management you have somebody that's not really a great fit, and luckily that person's gone, and so now the CEO of Nobel Biocare, Stefan Nielsen, has really looked to reinvigorate, get back to where we were, get back to innovation, get back to solid research, and then bring a much nicer sense of community to the whole company, and also to how it works sort of globally. So you see a lot more of that. You see even in the social media feeds, like looking back at the history of where it came right back from Brånemark's time, and then also a reinvigoration of these conferences, because the conferences are a great way to see what's possible, what's available, but also what's good on a day-to-day basis. So, you can see something that you can go, you've pretty much reached perfection in replacement of an anterior tooth, but that might work, in a lecture case, or a case that is like everything just goes perfectly. But what's the fallback to that? What's the, is it reproducible? Can you get this? Can you do this on all patients, or is this just something that just the best in the world can achieve? And the idea now, I think, is that we're getting to the point where we've got the techniques and we've got the componentry to be able to get that 95% of the time. You get like a really great result, and so that's kind of like what I'm trying to push with this symposium that we're having in August, which we'll obviously talk about, but in April. April. So, is sustainability, and also being able to be more accessible without doing really fancy sort of treatment to get that.
I mean,
but I think with the history of these big conferences as well. So my first experience with it was in 2006 with the World Tours, and so those involved, we were doing like guided surgery programs. We had the ABC film crew in. Glen would be doing an operation that was then beamed somewhere around the world at that time, and so the logistics of getting that organised, it's a lot easier with technology these days to be able to make it happen a bit more seamlessly. But so those world tours went on consistently through I think the last one I remember was 2015, I think also in Sydney, and I remember moderating a session with Joseph Kahn there. And by having the great speakers that Nobel has had all the way, you've also got people who are open and honest about things that have happened. So things that were shown many years ago, and then going, this was the best at that time, but in actual fact, now we've realised, for whatever reason of biology or componentry or improvement of design, improvement of technique, that's not the way that we would advise things being done, because not everyone does read the literature. And you can have something published and that then stays in there, and someone who picks up the journal and reads it thinks, oh, this is the ultimate, and then they don't read anything else afterwards. So they get stuck doing there. So it's a great way for people to keep learning, keep developing, find out and having people who are prepared to say, I was wrong and I don't do that anymore, which is where that losing that opportunity for those big conferences for that period of time, I think it was really sort of damaging as a clinician as well, because you're hoping that everyone is getting the opportunity to do the best thing. And so now with that reinvigoration, and Barcelona was I think a fantastic sort of reinvigoration, and then you mentioned Las Vegas last year as well, but this APAC one, the regional one coming up in April, I think is going to be an amazing opportunity for the local delegates here, because not everyone has the opportunity to travel globally, but Bangkok's not too far from Australia,
yep.
and central in Southeast Asia for people to get to, and the speakers that that are going to be at the conference, I think, are really going to showcase where we're at from current technologies, future technologies, direction, but as Glen also said, consistency of approach for what is achievable in most people's hands.
Yeah. So the dates for the Nobel Symposium, I think it's April
28th, 29th, 30th of April.
29th to the, what is it, 29th to the, we're all going, we should know.
Yeah,
really.
28th. So the four conferences, I think, is on the 28th, and then the main program 29th and 30th of April.
Obviously, we were all in Las Vegas together, purely for the educational element. Although we did tend to enjoy a few drinks as well, and I think that's the other big thing about these conferences is who you get to meet. Everyone is. You just meet so many different people from around the globe. Get to hang out with them. Make those connections, and there's people I've met at early conferences that I'm still in contact with, 3, 4, 5 years later. So
make some lifelong friends
absolutely,
through it, and it's also that opportunity that you might see someone presenting, and then because all the speakers are around for the duration of the conference, to then have an opportunity over, the morning tea, the lunch break, the after events, whatever it is, and actually have a moment to ask them, saying, in this situation, well, what would you actually do, or how can I manage that? So, when, as a speaker involved, we're talking to everyone else as well, and discussing, as we're talking about as a specialist, discussing with other specialists and other people about certain things. It doesn't change in the conference world as well, and it's those behind the scenes conversations which really helps, I think, to push the direction of what we do.
Yeah.
And coming up with ideas or different modalities to actually keep pushing the envelope safely.
So we've got the FOR conference on the 28th of April, and then the Nobel conference runs for the 2 days after that. Any particular highlights, speakers, apart from yourselves, obviously, that you're looking forward to hearing?
Look, there's some fantastic speakers. There's some masterclasses that are going to be hands-on workshops that are going to be spectacular.
I just managed to get a place on Tony
Rotondo's in Iñaki Gambarina.
So I'm very much looking forward to that.
I think Tony Rotondo's one of my favourite prosthodontists, and Iñaki Gambarina, I've known him for many years, and I probably learnt more from Iñaki than anybody else.
Wow.
So, and he is fantastic. So from an aesthetic, workup and his handling of tissues and all that sort of stuff, absolutely fantastic. Obviously, I have to give a plug for my one, which is I'm working with Tristan Stas on anterior single tooth replacements using N1. I think that is really a great system, and it's something that is when I was talking before about can we get to perfection?
Yeah.
We're there.
Yeah.
In a lot of the cases, and it's an easy system to use. So you don't have to be a Formula One driver to be able to do it. You can be, an Uber driver and still manage to get a really fantastic result with this. And so that's something that I think is well worth sort of seeing, So, and I'm not plugging myself, I'm plugging the actual event.
Yeah.
You know, and you've also got All on 4 workshops and things like that as well for those that are interested in that. There's going to be a lot of really interesting stuff.
Yeah.
So, and I think if you didn't come away with having learnt at least a dozen new things, I'd be very surprised.
Yeah. I think it's a huge amount of information packed into the 2 days, and even therefore our program in Las Vegas I found really good, because we had the emerging lecturers on there that gave some fantastic presentations, which was certainly for me very inspiring, looking at their level of presentations. What about yourself, Graeme? Anything in particular you're looking forward to, apart from running a workshop with myself?
Well, I think that's going to be highlight of the program, our workshop on All on 4, you know, the surgical approach and management for that. So have heard that that's just been increased in numbers as well. So we're certainly going to have our hands full on that day. But it shows, you know, it's a popular one, so we must be doing okay. But I think guys like Giacomo, and he's always, you know, phenomenal to listen to, and the way that he thinks about the biology and, you know, using the componentry and the results that are able to be achieved in that predictable way. And then the advancements of the navigated surgery and progression into robotic surgery as well. Those sort of digital workflows, I think they're always interesting, and to see where some of those future directions are going and what's being done on that global spectrum. So I think every day, every session, there's someone amazing. It's certainly not something that you want to miss anything. And I think the challenge with these conferences is just not being able to get to everything. And you know, if you're there sort of taking handwritten notes, as back in the day some people, you know, did, and you know, your notebook's going to be full, and these days your phone's going to be full from, you know, capturing all those little snippets of information. But it's going to be a phenomenal conference.
Take an extra battery for your phone, you know, like
well, it's always interesting because when I go to these conferences, and you know, I've got two highly regarded specialist prosthodontists sitting in front of me or behind me, I know it's a good lecture when you guys are taking photographs. So it's always a good sign. And
one of the challenges with that is because you always try to keep abreast of the literature, and then you'll see an article that's there and you think, I need to read that. You know, I need, how come that hasn't come up in my searches? And so then it's the homework to go home afterwards and have a look for that. But there's always little nuances of what people do. And that's why it's always interesting. You know, Glen mentioned it earlier, you know, the learning never stops. And, you know, from a national body perspective, you know, we're required to do 60 hours of CPD. Every time I'm filling out my logbook, you know, it's 150 plus hours every year, because you need to be doing that to make sure that you're doing the best thing. So these conferences are great to get a lot of CPD hours in one venue as well.
And no doubt, being a Nobel conference, the social events will probably be pretty spectacular as well.
Yeah, I mean, it's Bangkok. There's some big parties that have been sort of planned. The food's going to be fantastic because obviously everyone loves Thai food. But I think it's usually very spectacular. The AV always blows your mind. So it's not just the conference aspect, but everything else is, you know, very well sorted.
And myself, I've been actually moderated by yourself. I'm going to be doing one of the emerging leaders talks. Any advice for a newbie to such a big stage?
Stay at a time, otherwise I'll be hooking you off.
Okay.
You're serious about that?
I'm serious about that.
Stay sober.
Sober's good, although sometimes I think with newbie lecturers, it's always a time thing. It's a time thing for us, you know, and you've always got too little time to create what you want to create. I think sticking to the topic that you're going to talk about, which is a great topic. I'm not going to, you know, tell you too much about it yet. You just have to come and see Dave. He's going to be great. And I think that you know, sticking to the topic, making sure every slide is clear. Photos are great. Cropping out anything that's sort of like unnecessary, like retractors and things like that. And keeping the points, you know, succinct. So it's all about being succinct and telling your message in the time that you've got, which is the shorter the time, the harder it
Yeah.
becomes. Obviously, we can all ramble on for hours if we've got the time,
Yeah.
which you're used to giving day-long
Yes.
courses, etc. But yeah, doing a 15-minute talk is
I've found
a lot
it
tougher.
really challenging actually, because like you say, I've been running courses for a few years now, and it's normally me waffling on
yeah,
for days,
Yeah.
and suddenly I have to find something that's going to
Make
be
it
interesting
concise.
and
Yeah.
of value and
punchy.
and
Yeah.
punchy and present it in 15 minutes. So
I mean, it's interesting because, like I've been moderating and scientific directors and things like that for a fairly long time now, and you can tell, like the guys that are doing it all the time, it's all like they're on the minute, and then you see the new people, the people that are used to being in a university setting or something like that, and they've got a 15-minute lecture and they've got 200 slides, and they're on all sorts of things. They're supposed to be talking about blue cars, but they've got pictures of red bicycles, and I said, well, why have you got the red bicycle in there? And they'll go, oh, because it's a really nice red bicycle. It's like, yeah, not interested. Got to get rid of all of that.
Yep.
So
This is where Pat was fantastic, because I remember, when I was my first symposium talk for Nobel, and Pat was running the conference, and every speaker had to present in front of Pat and run through everything, and he was brutal again. It would be, no, change it, don't want that, yes, fine, next, move along. And you come away from that thinking, I've put, weeks and months of effort into putting this together, and he wants me to change it. But then those things, you go and you do that, and the end result has been completely worthwhile.
Yep.
So
I would add that it's not the content though.
Yes.
You can say whatever you want about, like it's never sort of, you're not going to have the content change because it doesn't fit with, I don't know, Nobel policy, or it says something negative towards it. That's not what we're after. We're after the actual truth. But and so there will be warts and all types of things discussed about everything to do with implant dentistry. So it's not that. It's more just keeping it succinct to the topic that you're supposed to be talking about.
Yeah.
But 15 minutes is easy to practice.
Yeah, I think we spoke about the subject, and do I pick out a case, and do I do a single tooth, do I do a full arch? Obviously, a lot of what I do now is all on four based, and I think we kind of agreed that it's hard to compete on a stage like that. I'm not going to show the most beautiful full arch, because actually all on four, as we know, is actually quite simple. So what my subject is going to be on, and I'm still working on it, is sort of more a bit of a realistic look at what I've experienced over the last 10 years doing it, which is some complications and some problems, and now what we're doing to try and finesse what is a simple technique, but it's actually what we found, and you guys have, it's the fine details that matter when it comes to longevity. Anyone can bang out an all on four realistically, quickly, but actually when you start to see those cases come back at 5, 6, and you guys much longer,
absolutely,
that's when you can track back to much smaller details, I feel.
And that's kind of like what we're after with these conferences, is to showcase what is like the absolute cutting edge and what can be done, and the most fantastic result that you can possibly get, but also combining that with what's realistic for practices, for people that are working and they're not spending 8 hours on a single tooth implant, so that a bit more, they're in a private practice. They're not in a super high socioeconomic. They're not working in Manhattan or something like that, but they're working in the real world, and that's kind of like, you've got to also develop good protocols and teaching for that sort of for the majority of the people on this planet. That's what we're looking for, and things like all on four is one of those things that, and this is why we were like quite happy about that topic that you came up with, because all on four looks simple on a brochure or something like that, but it's full of like little details, and those little details, how much you do here and what you do there, placement here, blah blah blah, all that type of thing will add up to whether the result is like a 10 out of 10 or whether it's like it's a just pass. So, and that's kind of where we're at. We're trying to just bring everyone's overall expertise up a bit.
Were you just trying to cut down the workload for our session? Just half the lecture, you'll just repeat that half in the hands-on something there as well.
Well, even our, we've scratched our heads on how we we cram in, what we want to get across in a workshop. And
it's tough to do. It's tough to do.
Yeah.
It's tough to do to teach people all the nuances in the right way for it, to then have someone who's then safely going to go and treat afterwards, because these programs need to be done over days and days and days. It's hard to condense it down into a 2-hour session.
Yeah, but hopefully you can get a taster of what
absolutely
what's going on, and then they can go and do further training. So I'm Dr. David Norcross, and thanks for listening to the podcast. See the show notes, leave a comment, all the details will be below.